thanks. Good, really good, and good to be on the show, as always.
Mm.
Yeah, just trying to sort out
But
the technical bits, but yeah, I'm really happy, really good. Yeah.
we thank God. We thank God. The family okay? Everybody okay?
Yes, everyone's well, thank you. And how's everyone on your side?
Yeah, everybody's great. Everybody's great. Right, especially, there's not a lot of news of what's going on with the COVID situation. I've checked this morning, and I can't find a lot of stories concerning it. Why do you think it's that? Do you think it's because we've just settled into the whole situation of the lifting of the lockdown and all that?
I think there's a few things. I mean, there's a lot going on still, I would say. I think it's still not. Obviously the guidance has changed, and I think people are still getting used to that. But yeah, there isn't that much apart from changes in the travel, and also, in terms of other aspects like I think a lot that in the media is about not wearing mask, about children not being vaccinated, and also about mostly about travel. That's what I've seen. And obviously, there's been talk about nightclubs because obviously nightclubs have been opened up to people to be able to go into nightclubs, and there's any number of people have been told that, according to Freedom Day, is that they don't have to wear mask. But having said that, I don't know what your impression is. I've seen people still wearing mask when we went out, so I don't know what you've been seeing.
Well, I can't go out at the moment, so I won't be able to tell you anything that's happening in the outside world because I'm supposed to be self-isolating. But yeah, there was a story actually on. I saw it earlier on, and I'm trying to look for it. I can't seem to find it, but it's about. Well, it's a COVID story, really. I didn't find a lot, but I just found that particular one. I can't find. I'll look for it, and then when I find it, we will talk about it. Where is this thing? I'm just sorry. Forgive me for that, but I'm just trying
No, that's fine.
see if I can find that particular story.
Yeah. No, that's fine.
Yeah.
So yeah, it's just a lot is about traveling. So I think with the EU,
it is about traveling. It is about the fact that I just read the story actually on the UK news. It's about the fact that people traveling from amber countries will not be expecting. They will not check them for COVID at the airports because they're leaving everything to the carriers, the airlines, to do.
Yeah.
So they're saying that they're doing that so that they can cut down on the queues.
Yeah.
The airports and all that, because definitely we know since this lockdown's been lifted, there's going to be a lot of traveling.
Yeah.
People are going to be going out and people are going to be coming in a lot. So, to cut down on queues at the airports, which I saw a couple of times, terrible queues. So they will leave the checking, as it were, to the airlines or the carriers.
Yes. So so I think there's a lot of. I was trying to actually go through the whole list yesterday of the amber, the green, and the red list. So there's still a lot of countries on the red list, and obviously amber countries. Each country will have their own own travel restrictions and guidance. And so I think everyone that's traveling is urged to have a look at the guidance before they actually make plans, because people might need COVID passports. They will need to have COVID testing done within 24 hours or 72 hours. Some places, when you get to the airport, you would be able to have testing done. And other places, you would need to have testing done on day 1 and then or when you arrive, and then again at day 6 or 7. So there's various different guidance for different countries. But I think from what I read yesterday, it seems that the EU is obviously countries that are being quite strict, and especially France. I think France, the article I read was talking about the Delta variant. So they were concerned about the Delta variant and some other variants, the South African variant, because they were concerned of the spread of that in the EU, in the European countries. So yeah, there's a lot going on. UK is obviously there's a lot of countries that still don't allow and are not allowing British tourists to travel.
Sashi, can you please speak up a bit?
Okay.
It feels as if you're a bit slightly muffled.
Okay.
So,
okay. I wonder
yeah.
why. Yeah. It might be the connection. I can check that as well. Yeah.
All right.
Yeah. Okay. Go on. Yeah.
Yeah.
Yeah. I'll try and speak. Is that clearer enough?
Yeah, it's better now, actually. It
Okay.
is.
Okay.
Yeah.
All right.
Well, the other thing, you know, these restrictions have been in place and they're still in place. They're talking
Yeah.
about the different, you know, the traffic light system, the red,
Yeah.
the amber, and the
Yeah.
green. With the amber countries,
Yeah.
which contains most countries, the
Yeah.
restrictions have been lifted. I mean, like, you don't have to self-quarantine
Yeah.
for 10 days as long as you have a negative
Yeah.
COVID test. And but you must still
Yeah.
have a day 2 test. So you have to you pay for a day 2 test before you come in. And so on the second day, or just before the second day, you can do a test. And if it's negative, that's it.
Yeah.
You don't have to quarantine at all. Except, of course, if you test positive,
Yeah.
then you're advised to stay indoors for 10 days.
Yes. So that
And
I think that is I'm not sure how I would feel if you're going on holiday and then you have to get tested, and then you're already in isolation, and then you have to then obviously you turn out to be positive. So I think that's quite difficult, isn't it?
Yes, it is. It is.
And I think because a lot of people, as someone else has said, that test can be even positive if you have orange juice, or there's certain things that, you know, if you have, that the test actually becomes positive. I don't know how true that is, but that was what I was told. I was planning to go to Luxembourg in August, but the guidance has changed, so I'll not be able to travel. So they are not allowing third country nationals, so people from the non-EU. And also, Luxembourg is a country not allowing having travel restrictions until the 31st of July. So anyone coming from the UK will have to be in quarantine for 7 days and have testing immediately when you enter the airport, and then again on day 6 or 7.
I see.
Yeah.
I see. With all these COVID updates we're giving, we've never really talked about Luxembourg, have we?
Yeah, no, but
No.
they've been very strict in terms of the guidance. But I was reading France yesterday. Someone alerted me. Another person messaged about France, and so I was reading up on that. And so France again, you know, they are concerned about the spread of the Delta variant and the Beta variant. So I think there's concerns over the South African variant and the Indian variant.
The Delta variant is a bit of a problem, I'll say, because I do not understand. Well, we know there's a variant, the Delta variant, you know, originally from India, we're here, but I don't understand how, why the Delta variant is that worrying.
Yeah. I think most of the variants are that. So if we just go back a bit, so I think how to understand it, Apoku, is every country is going to have a COVID strain. So we had the main COVID virus, which is the SARS-CoV-2, so which is the main structure of that virus, you know, the protein structure. And then what has happened is, when it's come to each country, it's come to UK, it's gone to the rest of the world, South Africa, India, Japan, China, you know, all over the world, USA, Brazil, Nigeria. So it's gone all over the world. And then the structure, when it's gone and infected a person, a human body, it's then obviously changed its structure, so it's mutated. So that protein structure with the spikes that we see has changed because it's mutated. It's in its host, which is a human. So when it's caused the infection, so it sounds quite technical, but that's the way to understand it. And then when it's gone to each country and it's attacked and infected the host, it's then changed its protein structure. And that's where we get the beta variant, the delta variant, the lambda variant from Peru, the Kent variant from the UK, Brazilian variant, Japanese variant. So all these variants we've seen has been specific to that country. And then what has happened is it's then been able to spread to other countries. So the concerns are twofold. One is because it's changed its structure and because it's now mutated, it means that the virus becomes stronger than what it is. So we say it's more virulent. So in order to cause infections and become more infective, it changes its structure and mutates. And then it mutates differently, double or triple mutates. So that's when we get these different variants. So the concern is, one is that it's mutated. Two is that whatever treatments we've had for the original SARS-CoV-2 is that treatment will not necessarily work because it's already changed its structure, making it more difficult for us to actually fight the virus infection in our body with any treatments or naturally. And then the third thing actually is the vaccines. So that's what I've been reading up a lot about, especially with France. They are saying that people who have had the AstraZeneca and the Pfizer necessarily are not protected against the Delta variant.
I was actually going to ask you about
yeah,
protection
yeah,
from the Delta variant
yeah.
vis-a-vis the vaccination. So yeah, just keep on. Just go ahead and give us the information on that.
Yeah. So, I mean, the information is that it's better to have the vaccine than not, as we discussed yesterday. But
Mhm.
the figures have suggested that even if you do get the vaccine, people have still gotten infected and some seriously ill with the vaccines. So even if they've had the Pfizer or the AstraZeneca, Johnson and Johnson, I'm still uncertain about that, but as to how effective in terms of the variants. But you must understand, Opoku, when we started off with making the vaccine, the countries worldwide, we know that they used the original structure of the SARS-CoV-2. So they were looking at fighting against that infection. So they were not prepared for the variants and the mutations. So obviously, because the vaccine is actually made to fight against the SARS-CoV-2 virus, but then it's mutated to the different variants, the Delta variant being one of them, the Kent, the Lambda, and all the other variants, Beta. So that's why it's not 100% effective, because we know that even the vaccines were like 90 to 96% effective against the COVID-19 strain. So now, even with the vaccine, it's not 100%, and people are still getting infected. So I think this is what we are hearing, we are seeing in the media, and we are being urged to take the vaccine because even though it's 100% effective, it can still somewhat help. So it's better to have the vaccine than not to have the vaccine. But having
What about
yeah,
the hospitalization numbers?
yeah. So in terms of the vaccine or hospitalization, in terms of um, the virus.
Well, in terms of those who've had the vaccination rollout, really, is it true that it's cut down on hospitalization numbers?
Yes, definitely. I mean, as we saw yesterday, we had quite a large number of people getting infected with COVID-19. But in the UK, we are looking at about 14 to 30 deaths per 24 hours, which obviously indicates that that is much less than what we've had. For example, last year, March, we were seeing people 500 to 900, up to 1,000 people dying a day. So definitely it has reduced the number of hospitalizations. It's reduced the burden on the NHS and also on the healthcare workers who are working on the front line, which we're grateful for. So it's obviously has helped. Definitely, I mean, having the vaccine, but we also know that, as we've discussed previously, the vaccine does have side effects. So, like with any vaccines, it has its side effects. We have heard reports of initial 1 out of 4 or 5 people might present with fever, headaches, muscle aches and pains, and pain in the area where they've received the vaccine. Some have had more serious effects, as with which was reported with the AstraZeneca, such as clots and cerebrovascular disease because of that. So obviously, every person needs to make that decision in terms of whether it's safe for them to have the vaccine or not. And people who obviously have had previous reactions or previous allergies to certain medications and vaccines and underlying health conditions will obviously need to take precautions. So yeah, that's the situation with the vaccine. I'm not sure how you feel, Apoku, about people that have been vaccinated and not. And as I, yeah,
I don't think I don't know. I don't know.
Yeah.
You are more of the medical person, so you will you've got a better knowledge. One thing that just crossed my mind right now that we haven't talked about for a very long time is the hydroxychloroquine.
Yes, the medications.
The medication, what's it?
Remdesivir.
Yeah, all that. We haven't talked about those.
Yeah.
About medication and care, as I'll say, for a very, very long time. What's going on with that?
Yeah. So I mean,
people being treated with these drugs.
Yes, so we'll talk about general treatment about COVID-19. So basic general treatment when people do get infected, as we know, can present with symptoms of mild symptoms such as fever, headache, runny nose, anosmia, loss of smell and taste, which were the symptoms that came very early on, which obviously then alerted people that it's possible that you might have COVID-19. Later on, obviously, people can develop more severe symptoms like chest pain, difficulty breathing, this oxygen saturation goes down, anything going down from 90, 100, going down 98 to 84. Obviously, anything less than 90 would be a concern, or even 95, I would say. But our cutoff in the hospitals are 85. And obviously temperature more than 37.7. Other symptoms of presenting with features of a chest infection, respiratory distress, and difficulty breathing. So and later on, obviously, as the virus becomes more and more severe, it can present with changes on the chest X-ray suggestive of lung problems, pneumonia, chest infections, and a COVID type lung infection, and therefore treatment is needed. So, as you know, the symptoms can present from mild, moderate to severe. And children obviously present atypically because they might not have symptoms. A lot of people can be atypical and asymptomatic, so they might not have any symptoms, but they might test positive. So in terms of treatment is obviously general supportive treatment, taking medication for pain and fever, like paracetamol, and obviously avoiding ibuprofen if possible, especially people with high blood pressure and taking high blood pressure medications. And then looking at taking fluids, getting enough rest, and eating a healthy, balanced diet and exercise. Oxygen, a lot of people have, we've heard around the world, you've heard about stories where people have had the pulse oximeters and also oxygen supplies. So that has helped a lot of people in the initial phase. I'm just going through the different treatments so we can start off, because people can think about how to actually, if they do get infected, how to support themselves or their loved ones or anyone that they know that's gotten infected. And then obviously if it's more serious, when people have had to go to the doctors or the pharmacies or seek further hospital input in terms of the general wards, A&E, or in ICU, people have had been put on treatment. So the treatment that the GPs would recommend would be anything from the steroids, So we know that steroids were one of the treatments that was quite effective and is still quite effective. Second treatment was the remdesivir, so the Ebola treatment, which has also been effective. Thirdly was the hydrochloroquine or the chloroquine, which is the anti-malarial treatment, which also protects against COVID-19, and people have recovered. So there's a lot of evidence, a lot of research still being done, UK and worldwide. And then we haven't really spoken, but it's an anti-worm medication, but ivermectin. And I've heard and I've read a lot of research that ivermectin, a lot of doctors and GPs will not prescribe it, Apoku, but ivermectin is because it has a lot of serious side effects. And it's an anti-worm, so it's a deworming medication, anti-parasite medication. You might have heard of it, but so ivermectin, South Africa was had lots of research of people getting well taking ivermectin. Other countries, USA as well, Australia, New Zealand, and even in the UK. I spoke to someone last week, and she said she had COVID and she took ivermectin, but it wasn't prescribed by. It wasn't it's not being prescribed by the general doctors. So I think whatever medication, just a disclaimer as we're talking, as we always say about, we're just giving advice about what people are saying has been used and what obviously has been advised. However, please do consult your doctor, your GP, as we are not giving out information that this is a treatment you necessarily have to take, because every treatment obviously depends on the person, the side effect profile, and people that might have allergies or underlying conditions. So ivermectin is something which I know and I've heard and read a lot of research. People have recovered even just with one dose of the ivermectin. So those, and then obviously the anti-HIV medication, the lopinavir and ritonavir. So the anti-HIV medication has also been used with good effect. So there's a lot of treatment that is available, and obviously taking vitamins, alternative. We've spoken about the drink that was being used in other countries. So the Artemis, it's called Artemis. The drink that was used. So it was also, I think, used previously for malaria as well.
The Madagascar one.
Madagascar one, yes. So obviously there's a lot of alternative remedies, like having a combination of drinks with ginger and honey and lemon, with turmeric, with lots of other alternative substitute. So that also has been proven with basil and a whole lot of other remedies. So a lot of people are looking at alternative and lemon, drinking warm water with lemon as well, gargling with salt water. But I think in addition to all of this, I think the main measures are social distancing, so maintaining at least 2 meters distance, hand sanitizers, avoiding hugging and, obviously close contact, which is difficult, but, and washing your hands for at least 20 seconds and wearing a mask. So
it is difficult, but we've done it for more than a year now, so we should get used to it by now.
Yes.
Anyway, shall we do also soon? The time's just run out. So
I can't believe that. I cannot believe that. And you just made me. I just carried on talking, but I just thought it was good.
That's all right, because we needed that information, so that's fine.
Yes, I think that's good. Yeah. Okay.
Yeah. Let's do the numbers now.
Please. Okay. Thank you, Apoku. So according to the Worldometer, so according to it's the 21st. It's 21st July already. The time is just
already.
I know. So, and before we know it, it'll be Christmas.
Tell me about it.
Okay, and hopefully it'll be, we'll not be reporting about this in a good way. We can be reporting about something else. So that's hoping and praying. So, so around the world, according to the Worldometer, 21st of July, we have 192,278,425 positive cases. Total number of deaths is 4,133,000. 8,988. Total recovered is 174,963,512. So quite a large number that have recovered. Yeah. So in terms of the top five, we have USA number one with 35,081,719, with 625,363. India is 31,216,337 positive cases, with 418,000, 511 deaths. Brazil, 19,419,741 positive cases, with 544,302 deaths. Russia, 6,006,536 positive cases, with 149,922 deaths. France, 5 million. So they're number five with 5,890,062, with 111,525. And you can see why France is concerned, because they are like even above the UK. So UK is number seven with 5,519,602, with 128,823 positive cases. South Africa, number 17 with 2,311,232 positive cases, with 67,676 deaths. And just to say, we've heard from a lot of people side effects of the vaccines, people experiencing even seizures with the vaccines in South Africa. So I'm not sure which, obviously the people are getting AstraZeneca and Pfizer, so which one I'm not sure, but people are being reported that there's side effects. Ghana is 101 on the list with 99,160 positive cases, with 815 deaths. So Ghana's done really well, pretty safe to be traveling to Ghana. Yeah, and UK, we're looking at UK for the last 24 hours, Apoko. So figures are 45,558 positive cases, with 96 new deaths. Actually, that's what I read last night before I went to bed.
96.
It was 96. Actually, it was 98 in one of the articles I read. It was actually headlined that this is now the highest figure on one of the days in March last year. So it actually is going up. So yesterday was 39,805, to put in context, with 19 new deaths.
19, yeah.
And today is 45,558 new cases, with 96 new deaths. So I think, to be honest, I think we were talking earlier, and what popped in my head was to talk about the research. And I think, and we were talking about the vaccine, and specifically they're saying, having the vaccine is better than not having the vaccine. But having said that, they're still seeing people even that have had the vaccine that are being treated for COVID-19 again. They've gotten infected, and people have been infected once, have been infected twice and thrice. So it's possible to be reinfected. The research, we've spoken a lot about the BAME community. You've had the other doctors come on as well, and they spoke quite well. But what their researchers have said recently is that the third wave in the UK is possibly going to affect the BAME community more than others, because
Why is that?
Because a lot of the BAME community have not taken up the vaccine. So there's still a lot of controversy, still a lot of myths and mistrust with taking the vaccine. And, it's understandable from historical perspective. So as a result, it's possible that the third wave, if we do obviously get into the third wave as we are in it at the moment, it's going to hit the BAME community a lot. So it's just something to bear in mind. And if people listening, just get some advice, get some more information, and, speak to your healthcare professionals, speak to your doctors, speak to other professionals in the field, and, make a decision whether you need to get the vaccine or not.
Fantastic. Thank you very much, Dr. Session.
Thank you, Poku. That was really good. That was really good.
Yeah.
Thank you. It's good to be back.
Yeah,
to
good. Yeah, absolutely.
yeah.
Hopefully, we'll see you tomorrow.
Yes. Have a fantastic day and lots of love to everyone. And yeah, stay safe. Obviously, you're staying very safe. So
Yes,
yes.
yes, yes.
And you probably
Right.
need to get more rest.
Well, I don't know about that. I don't want to rest anymore.
Okay. Thanks, Focus. Let's spread the love and not the virus. And
Absolutely,
stay safe,
absolutely.
everyone, wherever you are.
All
Yeah.
right. Bye for now.
Thank
Okay.
you. Bye bye.
Dr. Seshni Mudlia,